Did you know that denied due to non-compliance to standard of care may be due to encoding errors? Your CF4 encoder is the problem. Hospitals and doctors go about it the wrong way. After spending so many years in claims processing, I have seen so many hospitals lose thousands of pesos or even millions of pesos due to encoding errors of their staff. Claim Form 4 is not exempted on this. So Claim Form 4 or the CF4 was implemented last June 2018. And the goal is to assess the quality care or quality services given to Philhealth beneficiaries. So quality care means adherence to clinical standards. And part of the goal was to prevent fraudulent claims. So, I will make it simple. Now, Philhealth will pay your claims if you provide proof of quality services. So, quality services means the use of quality policies or clinical practice guidelines. Philhealth accredited doctors must adhere to CPGs. Okay? Wait, relax. It simply means doctors must avoid gross deviation from the CPG. You are not being dictated to follow it 200%. It's a guide and Philhealth knows that. What they do not want is gross deviation from the clinical standards. So you need to give Philhealth a proof that you are following the clinical standards. So this will cover signs, symptoms, lab, diagnostic results, clinical management, and the like. You need to encode it in a specific form. This is the Claim Form 4. So the Claim Form 4 is a clinical document. Friends, take note, this is a clinical document. Okay? Now, let us pause there for a while. Here's the thing. Now, CF4 is a prepayment auditing tool. This means before payment, Philhealth doctors or the system will audit your CF4. If the entries fit the clinical standard, then your claim will be paid. They want to see bits and pieces of the clinical standards in the Claim Form 4. Now, in my experience, 8 out of 10 doctors manage their patients based on the current CPG. Now, it is our assumption that majority of the doctors follow clinical practice guidelines. So, this is where the problem comes in. Now, the Claim Form 4 is a clinical document, but many hospitals and many doctors ask non-clinical people to encode their Claim Form 4. Non-clinical people are asked to make a clinical document. I have seen hospitals, doctors hire engineering graduate, HRM students, personal secretaries, unemployed teachers, you have relatives, even family members, okay, and accounting students. Now, all of them are not qualified. Now, I have seen doctors, okay, hospitals hire nurses, nursing assistant, midwives, medical technologists, or non-clinical hospital staff do the Claim Form 4. Now, many of them have clinical background, but many of them were not trained to do it. They were not trained to do the Claim Form 4. So, what to encode, what to prioritize, what must be highlighted, they do not know. So, there is a proper way to do the Claim Form 4. Now, in my experience, so the problem is simple. Your doctors follow the clinical practice guideline. That is good. But your CF4 encoder is not skilled in making CF4. So the problem is not the compliance to the clinical standard. The problem is the ability of the CF4 encoder to provide the correct information in the Claim Form 4. Now, Philhealth reads it as non-compliance to standard of care because the content of the Claim Form 4 is garbage. So many healthcare providers think CF4 is just another ordinary document. Many hire non-clinical staff to read a clinical document. It does not make sense. Now, others do not train their clinical staff on how to do the claim form 4. Thus, all of them have his or her version of doing the CF4. There is no standard. If your hospital will discharge an average of 30 patients per day, you need to have CF4, okay? Perfect CF4 for 30 patients. In a week, you need 210 correct CF4. In a month, you will need 840 correct CF4. Then, your claim will be paid. Take note, Philhealth wants to see proof of quality services. Proof must be written in the claim form 4. Friends, get qualified and trained CF4 encoders. Friends, this is Coach Doc Ben. See you in our next session.